Bismillah ar-Rahman ar-Rahim. I'm Dr. Amjad Mahboob. I'm currently working as Associate Professor of Medicine at Gajju Khan Medical College and Bacha Khan Medical Complex, Swabi, in Khyber Pakhtunkhwa. I remained a student of Post Graduate Diploma in Biomedical Ethics at CBEC uh, cohort of 2020. During the proceeding of this course, we were asked that we would be having a project during the course session. For that, we were guided that there are a lot of projects available from the previous cohorts which we can actually review and see that how we can move on with our own projects. Similarly, at the same time, as I explained that I'm a teacher as well in a medical school with students from undergraduate and postgraduate. We are also having students in our hospital from the University of Swabi who are enrolled as students in D pharmacy or Form D in the university. So during their education session, they are supposed to undergo a 5 months clinical clerkship in the hospital, which is a mandatory requirement for their degree award. So every year we get about 12 to 15 students from them, and it is a process going on for a couple of years. Now, during my PGD training education, I learned that there are many areas which are related to the pharmacy practice or the pharmacy workforce of the healthcare. Similarly, during the course of this training, I was asked to move for evaluation of a vaccine trial abroad, and during that, I actually observed that the role of pharmacists in vaccine trials or any high-tech medical trials where where people are involved is enormous, and this is an area which is actually uh, never considered to be as important in terms of biomedical ethics because of the new technologies and new developments and a lot of techniques involved. The right person to deal with all that at that very moment is actually the person who is involved in the process. So the general concept in past is like patient doctor interaction. Every time we push for it, that it's a patient doctor, and all the other players in the circuit are actually not considered. I moved on and I say that this is not just patient doctor. It is a patient or a research participant into a doctor, into a pharmacist, into a researcher, into a nurse. So the paradigm is not just revolving around one or two people, it is revolving around many. And pharmacists have a unique role during these processes, and that cannot be ignored. Similarly, with the evolving time and many changes in the revolution in the healthcare, there are many things which are important, like the the tension between the population health versus individual health care. This is something which is not considered in depth because most of the policies, if we want to improve the best clinical practice and things like this, so they move on to treatment pathways, and treatment pathways actually narrow down the management plan, and the autonomy is actually taken away from many decision makers because it is a pathway which is based uh, on some evidence. But there are instances where the pathway management may not be very beneficial for an individual. So think like this. Similarly, the resource limitations for many managements because of the when there is scarcity in resources, then the allocation of these resources, or if there is a short supply in medicine, this is all something which is revolving around the pharmacy practice. The psychosocial ability of patients during care, or if this is something related to this, like the decision making, if this is a disease where the treatment is something which is very costly, or there is a disease where the treatment is not supported, or the patient by themselves are having some issues where we feel that the patient is not would not be able to comply with the drug. So these are issues which all revolve around the person who is dispensing the medicine. So they would be the right people to know the ethics around those interactions. And similarly, these heroic measures around the end of life care, this is another area where a lot of people are involved. It is not just the treating physician. So these are all areas which are actually in the clinical practice. Similarly, I just touched upon the research aspect as well, that in the research aspect, with the evolution of many things, the pharmacist is definitely coming down to have a major role. So I selected this cohort for my project And I actually searched out that if there is any project in the CBEC which has ever been done on this cohort, which was not there. So I call it an eccentric decision, and I am actually grateful to my supervisor who supported me till the end. And I had interaction with the University of Swabi academia initially before starting this project that I am planning for something like this. What's your take on this? Can you please tell me about the curriculum that is um, supposed to be taught during the Form D, if it has any ethics component, and who are actually looking into it? So this is something which were like never covered properly, and there was, to my surprise, there is no code of conduct for any pharmacy in this country. So there were areas which we actually picked that okay, this is now a very right selection for my project. And I'm thankful to the faculty who agreed that okay, during their 5 months rotation of their students, I would be taking this project as well. So it was like a 6 session project, and it was like the faculty can actually acknowledge that it was a very quick project out of all the other colleagues, and it was very rapidly done because of some administrative responsibilities. But it was very well attended, and all my students realized that this is something which was never ever thought to them in the past. So in between this, there was a session which was arranged by an international organization regarding nutritional supplement implementation research, and they were presenting it to the hospital administration for implementation, for like to take the hospital on board for this. And I actually requested them that my students would be sitting in it. They would listen to this proposal, and they should be allowed to ask questions if it is any. They agreed to it, and when the thing, I mean, when the presentation ended up, the students started asking, and they focused on the informed consent component of that. And the presenters were like, they were not ready for those questions because that aspect was never challenged during their uh, previous presentation by anyone. So that ultimately led them to develop a proper informed consent, and then it was translated to local languages, and ultimately a huge component that was missing from that project was like added to it later on because of the student uh, questions. And my whole administration was like surprised. Oh, we never thought of it. On the end day, a lot of people attended that session, including the hospital administration, the medical college administration, and the faculty from the University of Swabi pharmacy department. So during the conclusion remarks from the University of Swabi pharmacy department, the faculty were very enthusiastic to learn about the whole details of the project, and they agreed to start this module to their final year student from the year 2022, and they would be submitting this whole project to the Pharmacy Council Academic Board for formal approval for future in the country as well.